Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about some of the skin changes in pregnancy. Pregnancy is a time of a lot of transition, and I do see during my practice lots of minor complaints of skin conditions, and we'll go over those a little bit, and some a little more serious, less frequent, we'll mention as well. First, it's very common for your skin to be a little bit more sensitive, perhaps drying issues, especially in the colder months when you're pregnant. And I recommend that you stick with a milder soap like Dove soap. And no, I have no endorsement with Dove. Just the Dove white bar soap instead of the liquid soap. Avoid the scrunchies or the washcloths. Just plain the soap seems to have the least irritation. Try to avoid very perfumey soaps or shampoos that smell like fruit. If you don't have problems with it, fine. But if you are having some irritation, some drying, some itching, then that might be of benefit. Also avoid severe temperatures, especially prolonged hot showers can cause some of that skin irritation as well during pregnancy. You will notice some darkening of your moles and of something called the linea nigra, a little darkening of the line down your belly, and that's a normal transition during pregnancy. You might also notice some red dots that can be what's called cherry hemangiomas, more common the older you get, and pregnancy can make them get a little bit more visible. That being said, you should always mention any concerning mole to your provider when you're seeing. There are some other conditions called PUPS, a long name, urticarial patches and papules of pregnancy. This can happen in your stretch marks and spread out later on in pregnancy. It can be pretty uncomfortable. You can use like a Benadryl lotion, changing a soap. Sometimes you have to use oral Benadryl to sleep. Sometimes you need other treatments that you need to talk to your physician. There are other conditions later on, more commonly in pregnancy, that can be related to issues with your gallbladder. So if you're having a persistent rash that doesn't go away around that time, or if you have blood pressure issues, that will be addressed with your physician, but be sure and bring it up. Another thing that's pretty common is to have some rashes under your breasts, or if you're a little overweight, under the hidden part of your belly. That is what's called tinea corpora. It's the same thing as athlete's foot. So athlete's foot, dark, sweaty, hot space. The same thing happens when you're pregnant. So if you're noticing that, using over-the-counter antifungal spray, that's a powder, twice a day for a couple weeks can help. Again, you can try it out, but any rash or irritation you ought to bring up to your physician and see their direct opinion. I'm just giving you an understanding of what are the possibilities here. So I hope you found this information of use. Please leave your comments. Thank you.